What is periodontal disease?
Periodontal disease is a type of disease that affects the gums and the surrounding tissue around teeth that support the teeth. And there's varying degrees of periodontal disease, ranging from simple gingivitis, where there's the occasional bleeding, to very severe stage and grade of periodontal disease, where uh, teeth are mobile, there's a lot of bone loss, and eventually teeth are lost. So it's a wide range.
What are the common signs and symptoms of periodontal disease that patients should be aware of?
The most common signs are bleeding of the gums, especially when brushing or flossing. When it's very severe, there's mobility of the teeth. The biggest problem with gum disease or periodontal disease is that there's very, very few signs and symptoms of disease. So, and that's a big problem because it goes unrecognized for a very long time until it's too late. And a gum assessment would need to be done. And typically, we do our gum assessments once a year or during the checks to determine the extent and the severity of the gum disease.
How does periodontal disease impact overall health?
Periodontal disease has a huge impact on overall health. The gums is a direct link into the bloodstream, and the bacteria that's involved with periodontal disease, some of it can be very, very virulent and dangerous. If it gets into the blood, it can affect organs, it can affect the heart. There's a lot of studies that show that heart disease there's a direct link with the bacteria that's in the mouth. It has a huge impact on prosthetic joints like hips and knees, with valves. It can have an impact with diabetes. There's a lot of studies that show that it negatively affects and it worsens the blood sugar index in diabetics as well. There's also studies that show that it has an impact with Alzheimer's. So there's a lot of systemic issues that have a direct link with periodontal disease. There's a lot of research out there on this.
What are the different stages of periodontal disease, and how is each stage treated?
That's a great question. Typically, when we measure the gums, it's a thorough and involved process where we go through and we measure all the teeth and the level of attachment, the depth of the pockets, whether there's bleeding or pus. And based on those numbers, we determine the different stages and grades of periodontal disease. And it ranges, there's quite a few of them. So there's healthy, then there's different levels of gingivitis, and then there's different stages of periodontal disease depending on how much attachment loss there is, so how much bone that's been lost and how much root is now exposed, as well as uh, we incorporate also other factors that have an impact. How fast is it progressing, and how virulent it is, how aggressive it is. So we take all these into account when we put together the diagnosis. So there's quite a few steps involved and stages and grades for this periodontal disease. And so based on the diagnosis, then we put together a treatment plan, a game plan, so we can address this disease and hopefully try to stop it. And we've been pretty successful with that. With a proper exam, proper diagnostics, and proper assessment, and then follow through with treatment, I believe that most periodontal diseases and most issues with the gums can be addressed and resolved, and therefore, we're able to help our patients keep their teeth for life, and that's the goal.
What does the treatment plan at Lynden Hills Dentistry involve?
So the treatment plan is specifically tailored to every individual based on the findings and based on our diagnosis of their periodontal disease. And it could range from, a simple visit where we go in and we debride everything, we clean everything out underneath the gums, and we may need to do this with freezing, to the more extensive types of periodontal disease where we're addressing, there's multiple appointments, it's done under freezing, or we may even need to do some gum surgery to address all the disease. So there's quite the range. Once we address the active disease, then our patients go into a maintenance therapy where they're seen regularly, and we keep the disease at bay, because otherwise, if neglected, it comes right back.
Do diet and lifestyle influence gum health?
Yes, absolutely. Diet and lifestyle have an impact on periodontal disease. With diet, I'll start there. The blood sugar level has an impact on gum health as well. So when blood sugar fluctuates a lot, there's an impact where the periodontal disease can worsen, and vice versa. Of course, when the body is healthy and the immune system is healthy, the body has a better fighting chance against periodontal disease, and it does remain at bay. So there is a very strong correlation between health and fitness and diet with this type of disease.
How does regular hygiene help prevent gum disease?
Regular hygiene is very, very important for prevention. It's important that the teeth and the roots are cleaned on a regular basis. If there's any issues involved, those would need to be addressed promptly. Otherwise, if it's neglected, the disease can progress. It can, or it will start to involve the bone, and bone loss, unfortunately, is irreversible. If we lose enough bone, then the teeth become loose, and eventually we lose the teeth. And it's very preventable. So it is very, very important for a person to continue with their regular maintenance.
How often should patients have exams and hygiene appointments for good periodontal health?
The number of times that a patient visits would really depend on their individual needs. I typically recommend 2 checks per year. That's the standard, that's the norm in terms of health. And then, depending on the extent or the history of the disease that's there, it could range from having the cleanings done twice a year or having them done 4 times a year. Typically, when there's a history of periodontal disease specifically, it's always recommended to have it done 4 times a year, so every 3 months. That way, the disease remains at bay and it's not causing harm or damage, and it's not progressing.
Are there any tools or technologies used at the practice that improve the diagnosis and treatment of periodontal disease?
So yes, there's a lot of tools that we use in the practice, and they range from the typical hand scaling, which is probably the most accurate way to really ensure that the roots are nice and smooth and clean, to various ultrasonic equipment that we use. We also use medicated flushes to help reduce the virulent count that's in these pockets. There's also laser therapy that can be utilized. And then, of course, in the more severe cases, we address it surgically. So we go in, and there's surgical techniques that we do where we're able to clean everything out and restore the gum health.
Do you collaborate with other specialists or healthcare providers to manage cases where periodontal disease impacts overall health?
We work with other professionals as well to manage periodontal disease. We work with a periodontist that's local. And typically the conditions that are more severe or unique that require a specialized attention are the ones that we would refer. And we also have a pediatric dentist that we work with in the event that we come across children that have some unique gum disease that requires specific attention.
Can children develop periodontal disease?
Children can develop gum disease. And it's very important to address this disease at an early age before there is irreversible damage or bone loss that may occur. And it's important as well to develop good habits with children and have a positive way of introducing them into dental care so that there's no fear or anxiety about going to the dentist. We're here to help and to maintain and keep things healthy for our patients and our children for the rest of their life.
What signs of periodontal disease should parents watch for in their child?
Children can develop gum disease, and the signs to look for parents are red gums, bleeding gums, especially when brushing or flossing, tenderness on the gums or swelling. Those are the things to look for. Typically, healthy gums in children should look nice and pink, should have a dry, stippled appearance to them. They shouldn't be swollen. So those are the things to look for.
Are children with braces or orthodontic appliances at a higher risk of gum disease?
Children with braces do have a higher risk of developing gum disease and periodontal disease. The problem with braces and hardware in the mouth is that it accumulates a lot of plaque and bacteria. And so it does cause more inflammation, it does cause more gum disease, and it does need to be addressed more frequently and carefully as well. So that's a great question. Typically, our patients that are currently undergoing orthodontics or braces are seen more frequently. We see them every 3 months to make sure that everything stays clean so that when the braces come off and the wires come off, there's no discoloration of the teeth, there's no cavities, and everything looks nice and beautiful.
How can parents help their child maintain good gum health?
It's very important, especially with younger children, to instill positive skills and traits, especially when it comes to helping them clean their mouths, supporting them with brushing and flossing as well. I always encourage flossing at an early age. That really makes a big difference, and that can prevent all kinds of problems, not just periodontal disease, but also with cavities. So it's important to, we want to give our children the opportunity to do it on their own because some are very independent. But I always recommend going in and just checking, I call it, and just touching up the areas that they may have missed, and then helping them with the flossing because that's a hand skill that is a little more challenging for younger children to develop. But eventually, by the age of 7 or 8, children should be able to floss on their own as well.
Can you share a recommended oral care routine to help prevent periodontal disease?
Yes, absolutely. A good technique or method, like you said, in the mornings and in the evenings is important to do the brushing and flossing. I have a model here that can show the teeth there. And typically the best thing to do is, avoiding the shoe shine technique. I don't recommend doing that because that can be sometimes destructive, but essentially doing circles on the teeth or vertical. And also, it's very important to angulate the toothbrush so that it can get into all the nooks and crannies. The other thing that's very important is to make sure that enough time is spent on every corner of the mouth. I find that with children and some adults, where they're quick to do it, and unfortunately, haste makes waste. It's not as effective. It's very important to spend at least 1 to 2 minutes in the mouth brushing, making sure every corner is addressed, every corner is tackled carefully, and then the flossing is very important as well. Getting in between all the teeth, wrapping that floss in a C shape around each tooth, and even behind the very last tooth. That's very, very important. For the majority of people, once per day is sufficient, but there are some patients where twice a day is needed. Those are the ones that tend to develop tartar a lot faster than other people. So twice a day would be very beneficial for that.
Do you recommend an electric toothbrush over a manual one, or is there much of a difference between the two?
I find that everything can be done with a manual toothbrush, However, the electric toothbrush, and it depending on the type of brush and the speed that it works on, it can be very, very beneficial. And it takes away a lot of the manual dexterity that's involved. So, with younger children, it would really help. And with people that may have difficulty with some of the fine motor skills and dexterity, the electric toothbrushes work really well. And with anyone as well, it's quite effective. But you would want a toothbrush, an electric toothbrush that's not very, very aggressive. And the most important thing really is the bristles have to be very, very soft, because hard bristles or even medium bristles uh, can be abrasive on the teeth and on the gums as well, and that can cause recession, which we don't want.